My name's Jason Jarrett. I'm an exercise scientist and an exercise physiologist. Every injury is unique and every fitness goal is unique. Work with me and you'll get the professional direction you need with your situation. Hi guys, welcome back to my YouTube video series, Method Works Physiology. I'm Jason Jarrett and obviously I'm an exercise physiologist. So today what we're going to talk about is what is an exercise physiologist, because they don't have them in many countries and it's a relatively new profession. It's not a word that I just made up, believe it or not. It does sound rather fancy, but it's not something that I just made up. It's not a fancy title for a personal trainer. I do work as a personal trainer part-time, but I also bring in my experience as an exercise physiologist into my personal training, and I guess that's probably why you get such an amazing experience with me, right? So I'm quite humble. What's an exercise physiologist? Well, we're allied health professionals. What's an allied health professional? Well, you've probably been to a physiotherapist or a psychologist, counsellor, chiropractor, audiologist, speech pathologist. You know what nurses are. We're all allied health professionals. Allied health professionals work to support the medical doctors, essentially, and specialists. So we are basically the support team for medicine. So that typically means that allied health professionals have a medical background, a medical health background. We've all studied that at university and we've gone on to do our particular area of expertise. Now, why does it matter? Why does it matter that you're seeing an exercise physiologist as opposed to a personal trainer? For example, if I'm seeing you in the gym, well, that's a good question. And it's a bit of a complicated one, I guess. So there are great trainers out there, personal trainers. I've worked with some amazing ones who have passion for what they do and they're good at what they do. I guess where exercise physiologists really shine is rehabilitation for clients with chronic ongoing injuries. They don't have to be physical injuries. We also train to work with people with mental health issues, because exercise definitely has an effect on mental health. So we tend to work with people more so who have musculoskeletal injuries. So that might be a shoulder injury, an elbow injury, knee, hip, back, you name it. So we intersect a lot with physiotherapists and often work alongside physiotherapists. Physios tend to focus more on the acute or subacute injury, and that's when you've just injured. You literally just injured yourself, you'll tend to get physiotherapy. And then we take over with the exercise specialists when it comes to rehabilitation for chronic injuries. Now, if you don't have an injury, you're still going to benefit a ton from the clinical expertise that I can bring to you. So there's going to be a lot of structure with your program, with the entire approach, really. And that's part of what you're getting with this workbook here that I talked about in a previous video. I challenge you to show me anywhere in the fitness industry that you're getting something like this. So I'm quite proud of it, obviously. But yeah, so an exercise physiologist is university educated, typically medical science degree with what's the equivalent of a major in exercise physiology. Sometimes they have a 2-year master's in exercise physiology. So we go to uni, we study medical science, and often work alongside medical science students, most of which are wanting to go on to become doctors. So they go into medicine from medical science, at least that was my experience. Exercise physiologists tend to be quite a passionate group of people, but also are very solidly grounded in evidence-based practice and the science. You'll find that quite common amongst EPs, exercise physiologists. It becomes a bit of a mouthful saying physiologist over and over. So I'll use the acronym EP for exercise physiologist. So how's an EP different from a personal trainer? Well, we're just more specialized when it comes to injury rehabilitation and injury management. It tends to be that personal trainers ought not be managing clients who have injuries. Personal trainers don't tend to have the training to rehabilitate an injury. A good personal trainer will work around an injury and still give you an amazing fitness-based session without making the injury worse. But personal trainers aren't really qualified to be delivering any type of therapeutic intervention directly on the injury. Now with myself, exercise physiologist, we can do both the fitness aspect and the rehab intervention, the therapeutic intervention for the injury. That's the difference there. You'll find exercise physiologists in clinics, in hospitals, in gyms, and in sort of athletic teaching positions quite often. I think, like I mentioned already, we intersect a lot with physiotherapists, sometimes with chiropractors and other allied health professionals. Today, I had a meeting with a general practitioner not far from the gym because we're setting up a referral pathway. So we take patients under Medicare, so they can get often a Medicare rebate or something along those lines. There's insurance coverage for exercise physiology services, as long as it's for an injury rehabilitation. So that's where we come in. Allied health, okay? Good. Excellent. And yeah, we overlap, EPs overlap a little bit with, well, quite a lot with personal trainers, and a little bit with physiotherapists. More and more so over the years, it tends to be that physiotherapists are doing more and more exercise interventions. So I've often had, the GP I met with today needed to know what was the difference between what an EP did and what a physio does. So again, physio does the hands-on massage, acupuncture, more taping. EP is going to do taping too. It doesn't tend to be in our what we do, and the physios do a lot of the hands-on stuff. We don't tend to do much of that. We do all the exercise therapeutic intervention. Beautiful. I think that's essentially everything I wanted to talk about. It's important to know because you need to know what value and what service you're getting. If you come to see me or another exercise physiologist, why am I paying this amount as opposed to, you're generally going to pay more to see an exercise physiologist than what you'd pay to see a personal trainer. Generally, not necessarily always true, particularly if there's an exercise physiologist who does Medicare rebates, bulk billed Medicare GP referred sessions, so that's quite cheap. So if you find an EP doing bulk billing sessions, they're working a charity, okay? So appreciate them. So the value of the service that you're getting when you come to see myself or another exercise physiologist is you're really getting a combined service. You're getting what's essentially going to look like a combination of personal training services and physiotherapy services. That's probably the best way to think about exercise physiology. You're getting a fairly fantastic value for the service, for what you're paying. And like I mentioned already, of course, you're paying more than you would for a personal trainer because you're not getting strict personal training services. You're getting clinical services. The gazetted rate for an exercise physiologist is usually around $120 per session. So it's really important that you don't just think about any sessions together as a personal training session. You're with a consultant, you're with an allied health consultant. Best to engage during our sessions and get the most out of our sessions. That's what I recommend. That's what I would do. So guys, it's been great. Bit of an educational one today. Please feel free to comment below or to message me here in YouTube if there's anything specifically that you would like to hear more about. Have a great day.